this video, the Center for Teaching at the University of Veterinary Medicine Hannover will demonstrate the placement of a continuous horizontal mattress suture. This video will focus on the technique of the suture. When placing continuous sutures, a single thread is used to create a stitch across the entirety of the wound. For this, a beginning and ending knot are required for each suture. Continuous sutures have multiple advantages, such as a quicker application and an even wound adaptation. Furthermore, continuous sutures are gentler on the surrounding tissue. This, however, comes with the risk of the entire wound opening if only a single knot fails. Irregular wound shapes also make the placement of continuous sutures more difficult. When placing continuous sutures, the stitch should begin on the side of the suturing hand. The horizontal mattress suture is suitable for the closure of larger wounds, especially in the areas under high tension, and for the adaptation of larger soft tissue. Both the beginning and ending stitch are placed outside of the wound gap. This suture technique provides a very even tension along its entire length. Furthermore, this pattern perforates the tissue completely, as well as protruding it outwards. Needed for this skills lab exercise are a needle holder, a pair of surgical scissors, anatomical forceps, the suture pad, as well as gloves and a needle and thread combination. When placing the suture on a patient, absorbable suture material is used. The needle and thread combination contains an atraumatic needle without an eyelet. Instead, the thread is connected to the needle directly. This allows for a smoother perforation of the tissue when driving the needle, causing less of a reaction. Therefore, an atraumatic needle is better suited for finer and more fragile tissues, such as internal organs, blood vessels, or the skin. In contrast, traumatic needles are separate from their thread. The needle's eyelet must be threaded before use. This eyelet and thread create a double perforation of the tissue when the needle is driven through, creating a stronger reaction. Traumatic needles should only be used on more robust tissue, such as muscle or fascia. A few general notes of the procedure. This video primarily focuses on the suture technique. Therefore, there will be no mention of placement or number of knots, since these parameters are highly variable and depend on the species, the individual patient, as well as the state of the tissue itself, and if it is the beginning or end of the suture. When suturing, the needle is only ever held using instruments. It is vital that the needle's tip is never grasped, as this quickly leads to blunting. Furthermore, the thread should only ever be pulled on with fingers. No instruments are used for this. The needle holder with fixated needle is held in the dominant hand, with the remaining thread collected in the palm. A right-handed suture will be demonstrated here, subsequently beginning on the right side of the wound. This pattern begins with a simple suture in intact tissue outside of the wound gap. For this, tissue on the wound's edge is lifted with forceps, and the needle is driven from the outside in and from the inside out through the tissue. Both ends of the thread can now be fixated with a surgical knot. It is also possible to use a slip knot for this. Finally, the beginning of the thread is shortened to 1 scissors blade's width. The following suture pattern lies perpendicular to the wound gap. The wound's edge can be lifted with forceps, and the needle is driven from the outside through. The needle is grasped with the forceps, and the middle to lower third is fixated in the needle holder. In the next step, the opposite side of the wound gap is lifted with forceps, and the needle is driven from the inside out. The needle can then once again be grasped with the forceps. It is important to fixate the needle in the needle holder in the position as it will be needed for the following step. As the horizontal retrograde part of the pattern now follows, the needle is turned by 180 degrees and fixated in the needle holder, allowing it to be driven through the same side, parallel to the initial stitch path. These steps are repeated across the wound's entire length. The suture is finished with a simple suture outside of the wound gap. It is important that the last bridge before the closing stitch is a loop, as this will be needed for the final knot. Both thread and loop can now be shortened to one scissors blade's width. Finally, the suture is inspected for proper closure.